Hello, this is Dr. Ross, and this is the video presentation that's going to take you through the appendicular muscles. In this presentation, we're going to look at muscles that move the shoulder, stabilize the shoulder, as well as move the arm, forearm, wrist, and hand. So the muscles of the shoulder and upper limb can typically be divided into four groups. You're going to have muscles that both stabilize and position the pectoral girdle, muscles that move the arm, muscles that move the forearm, and muscles that move the wrists, hands, and fingers. For those of you that have still remembered or still remember your regional anatomy, this is again going to come into play and help you remember these muscles with a little bit more ease than those of you who did not take that time. All right, so let's start with muscles that move the shoulder or glenohumeral joint. So these muscles are going to arise from the axial skeleton. We'll start with the latissimus dorsi. This is also called the swimmer's muscle. This muscle medially rotates the arm, and it acts as an agonist for extending and adducting the arm. It's going to be very wide along the back. The origin of this muscle, so remember the origin is where the muscle is not the part where the muscle moves. The insertion, where the muscle inserts, is the area that the muscle moves when it contracts. So the origin of this muscle is going to be the spinous processes of the thoracic vertebrae 7 through 12. It also attaches to ribs 8 through 12. It's a very large muscle. You can see down near the bottom. It attaches, an origin is the iliac crest as well. And then the insertion is the intertubercular sulcus of the humerus. So it's going to insert on the arm, the humerus bone of the arm, which is why it's going to move that area. Next is the pectoralis major. These muscles adduct and medially rotate the arm, and it's an agonist for flexing the arm. The origin here is the medial clavicle and the costal cartilages of the ribs numbers 2 through 6. It also has an origination point on the body of the sternum. And you can see this in this image here. The insertion for this muscle is the lateral part of the humerus near the top of that bone. There are also muscles that arise specifically from the scapula, and this is going to be, we're going to start with the deltoid muscle here. The deltoid is delta because it's triangular, and there are 3 sets of fibers on the deltoid muscle that when they contract, it's going to cause slightly different actions on the arm. So the anterior fibers, which they are going to flex and medially rotate the arm. The middle fibers are going to adduct the arm. They are an agonist there. And then you have the posterior fibers, and these are going to extend and laterally rotate the arm. So the origin is going to be the acromial end of the clavicle, or and the acromion and spine of the scapula, depending on which one it is. The insertion, you can see that they all 3 insert at the same point almost, and that's going to be the deltoid tuberosity of the humerus. Lastly, we have this very small muscle here in purple. This is the coracobrachialis. This is going to adduct and flex the arm. The origin here is the coracoid process of the scapula. The insertion is the middle medial shaft of the humerus. Okay, so now we're going to talk about the muscles that stabilize the glenohumeral joint or the shoulder joint. Okay, so the shoulder joint, remember, consists of the lateral ends of the clavicle and scapula along with the proximal end of the humerus. And then that creates the girdle where the head of the humerus in its ball and socket joint fits in at the glenoid fossa of the scapula. Okay, and then this can allow movement of the arm in multiple directions. So the muscles that cover this area are going to create what's called the rotator cuff. So the muscles of the rotator cuff are what I'm going to describe here. So these are muscles and tendons that keep that ball or head of the humerus in your shoulder socket. So first we'll start with the subscapularis. This muscle medially rotates the arm as well as stabilizing the joint. It's a large triangular muscle and it fills the subscapular fossa. You can't really see it, but when it contracts, it rotates the head of the humerus medially and adducts it. And that's when the arm is raised. And it's really powerful defense of the front of the shoulder joint. It basically prevents displacement of the head of the humerus. So I want to show another image of this with all these other muscles taken away so you can kind of get a sense of how large this muscle is. Right here we can really just see the insertion point of this muscle on the humerus. Here you can see the entire subscapularis. And so the origin here is going to be the subscapular fossa of the scapula itself, and the insertion, which is the lesser tubercle of the humerus. Next we have the supraspinatus, which is here at the top. The supraspinatus is going to be a relatively small muscle. It's of the upper back. This helps you rotate your arm, hold it straight out, and lower it. The muscle performs abduction of the arm, pulls the head of the humerus medially towards the glenoid cavity. Independently, what it does is it also prevents the head of the humerus from slipping. The origin of this muscle is the supraspinous fossa of the scapula, and the insertion is the greater tubercle of the humerus. Next is the infraspinatus. This muscle is a thick triangular muscle, and it occupies most of the infraspinatus fossa. Its main function is to externally rotate the humerus and stabilize the joint, so it adducts the arm. The origin for this muscle is the infraspinous fossa of the scapula, and then the insertion is going to be the greater tubercle of the humerus, and you can kind of see that in this image here if you just follow the muscle laterally to where it inserts. The last part of the rotator cuff muscles is the teres minor. The teres minor is a really narrow, elongated muscle, and its primary function is to modulate the action of the deltoid. Okay, so it prevents the humeral head from sliding too far forward and upward when the arm is abducted. It also functions to adduct and rotate the arm laterally. The origin of this muscle is the upper dorsal lateral border of the scapula. It's just above where the teres major will attach. I'm going to show you that muscle in a second. The insertion is the greater tubercle of the humerus, which you can't really see, which you can see a little bit in this image here. My apologies. So the final one is the teres major. That's also shown here. It's not part of the rotator cuff muscles, but it's located near the teres minor, and this seems like a good time to talk about it. This muscle is a medial rotator and adductor of the humerus, so that means it extends, adducts, and medially rotates the arm. The origin of this muscle is the lateral border, an inferior part of the scapula, and it inserts at the lesser tubercle and the intertubercle sulcus of the humerus. So it's going to be near the proximal end. Next, let's talk about the forearm, muscles that move the forearm. So the forearm is made up, of course, of the radius and ulna bones. And there are four main actions that happen as a result of moving the hinge of the elbow joint. You get flexion, extension, pronation, and supination. So let's start with the forearm flexors. The forearm flexors include the biceps brachii, the brachialis, and the brachioradialis. So starting with the biceps brachii, we can see that in this image here. The biceps brachii has two heads. That's why it's called the biceps. The long head, when contracted, is going to flex the arm. The short head, when it contracts, it will also flex the forearm. It will also help to supinate the forearm, but only when the elbow is flexed. So I'm showing you this image of the biceps brachii as well so that you can get a better idea of the origins and the insertion points. So the origin of the long head is that supraglenoid tubercle of the scapula. And then you can see the short head, the origin is the coracoid process of the scapula. So they both originate from the scapula, just on slightly different areas. Now they both insert in the same point, and they're going to insert on the radial tuberosity shown down here at the bottom. So the next muscle I want to talk about is the brachialis. The brachialis is an agonist for forearm flexion. The origin of this muscle is the distal anterior surface of the humerus. You can see that slightly in this image here to the right. And then the insertion is the coronoid process of the ulna. Last is this muscle on the bottom of the image called the brachioradialis. This muscle flexes the forearm. The origin is going to be the lateral supracondylar ridge of the humerus. So it's going to originate on the humerus, and then it inserts on the styloid process of the radius. So all of these are going to insert on bones in the forearm. So that's why when these muscles contract, they cause flexion of the forearm. So these are the forearm flexors. Next, let's talk about the forearm extensors. So these are muscles that when they contract, they are going to cause extension of the forearm. They're going to straighten your arm. So these are going to include the triceps brachii and the anconeus. So the triceps brachii has 3 heads, which is where it gets the name triceps. We have the long head, which extends and adducts the arm. And we have the lateral head, which is going to extend the forearm as well. The medial head will also extend the forearm. Now you can't really see the medial head very well, so I'm going to use this other image here where the other muscles have been stripped away. So on the left side of this image you can see the long head and the lateral head. And then if you remove that tissue, you can see the medial head on the right hand side. Each of these have a different origin. The long head is going to originate from the scapula, the infraglenoid tubercle of the scapula to be precise. And then the lateral head is going to originate from the posterior humerus. And then the short head is also going to originate from the posterior humerus just a little bit further down. Now, all of these are going to insert in the same place, and that is the olecranon of the ulna. Next, we're going to do the anconeus. This is going to be a muscle that extends the forearm as well. The origin of this muscle, you can see it's very small. It's on the lateral epicondyle of the humerus, and then it inserts also on the olecranon of the ulna. So when these contract, you can imagine it's pulling that ulna toward them, which is what causes the forearm to extend. So now we're going to move on to the pronators and the supinator muscle. So these are going to be muscles that rotate the arm into a pronating or supinating position. And you can tell which one I'm discussing. If you look at the image, there's an arm in the top left and top right corners. The arm in the top left corner is supinated. And you can imagine if your palm is facing up, you could hold a bowl of soup in your hand. That's a great way to recall which is which. The arm in the top right image is pronated. So let's talk about the pronators first. Here we have the pronator teres. The pronator teres pronates the forearm, and it originates at the medial epicondyle of the humerus and coronoid processes of the ulna, and it inserts on the lateral surface of the radius. The pronator quadratus also pronates the forearm. It originates on the distal end of the ulna, and it inserts on the distal end of the radius. Lastly, the supinator, this is the one that supinates the forearm. This is going to originate on the lateral epicondyle of the humerus and ulna, kind of distal to that radial notch. You can kind of see that there. And then it inserts on the lateral surface of the radius. All right, so the muscles that move the wrist and hand, we're going to talk about those next. So these are going to mostly originate on the humerus and insert onto different parts of the hand. And these muscles make up the bulk of your forearm. So the flexor carpi radialis, contraction of this muscle is going to flex the wrist. Basically, it's going to bend the wrist toward the body, and it can also abduct the hand and tilt that hand away from the body. The origin for this muscle is the medial epicondyle of the humerus, and the insertion is the base of the metacarpals 2 and 3. So you can follow that down in this image a little bit. Next is the flexor carpi ulnaris. You can see a little bit of this in one image and a lot more of it in the other. So please refer to the arms in the top left-hand corners of these images to get a sense of where this muscle is. And again, we're looking at a supinated and pronated arm. So the flexor carpi ulnaris is much more visible when the arm is in the pronated position. When this muscle contracts, it's going to contribute to flexing the wrist and adducting the hand, okay, adducting. It also helps to stabilize the wrist as well. The origin of this muscle is the medial epicondyle of the humerus, as well as the olecranon and posterior surface of the ulna. Now it inserts on the bones at the base of the metacarpal 5. The palmaris longus is it's kind of a weak bristle. It flexes the wrist weakly. It assists in bending the hand toward the shoulder. The origin for this muscle is the medial epicondyle of the humerus, and the insertion point is the palmar aponeurosis, so some tissue in the palmar region. Next is the extensor carpi ulnaris. This is going to extend the wrist when it contracts as well as adduct the hand. The origin is the lateral epicondyle of the humerus, like many of these muscles. It also originates a little bit from the ulna, the posterior border of the ulna, and it inserts at the base of metacarpal 5. Next is the extensor digitorum. This muscle, when it contracts, is going to extend the wrist, and it's going to extend the fingers. The origin is the lateral epicondyle of the humerus, and the insertion is the distal and middle phalanges of fingers 2 through 5. So for the last slide of this series, in this lecture, not the series, the last slide in the lecture, we're going to finish up on muscles that move the wrist, hand, and fingers. So the extensor carpi radialis longus, this is going to extend the wrist and abduct the hand. The origin is the lateral supracondylar ridge of the humerus. So like I said, most of these muscles are going to have an origin on the humerus. And then it inserts at the base of metacarpal 2. This next muscle is the extensor carpi radialis brevis. This muscle, when it contracts, will extend the wrist and abduct the hand. The origin is again the lateral epicondyle of the humerus, and it inserts at the base of metacarpal 3. The flexor digiti minimi is you can see it's pretty small. It's in between these two muscles. It is going to extend the fingers and wrist. It's weakly the wrist. The origin will be the lateral epicondyle of the humerus. The insertion is going to be proximal phalanx of finger 5. All right, so now we're looking at muscles that are going to be deep to the muscles in the previous image. So starting here with the flexor digitorum superficialis. This muscle, it flexes the hand as well as the digits at the knuckles, all right? And so this muscle allows for very rapid finger movements that you would use when you were playing an instrument or typing. And it flexes the wrist as well. The origin of this muscle is the medial epicondyle of the humerus, which you can see in this image, as well as the coronoid process of the ulna. It inserts the middle phalanges of fingers 2 through 5. Which you may be able to follow through on this image that we have here on the left. Now, deep to that is the flexor digitorum profundus. This muscle produces flexion and bends the fingers to make a fist, along with another muscle that I'm going to discuss in a second. So there's two muscles that help make this fist. First is the flexor digitorum profundus, which I have highlighted here. This one flexes the wrist. It also flexes the fingers. The origin is going to be on the anteromedial surface of the ulna. It also has an origination a little bit on the interosseous membrane. The insertion is the distal phalanges of fingers 2 through 5. The last muscle I'm going to discuss is the flexor pollicis longus. This muscle is going to abduct the thumb. All right, and if you follow this muscle down, you can see the tendons ending up there on the thumb. It originates on the proximal dorsal surface of both the radius and the ulnus, as well as on the interosseous membrane, and it inserts on the lateral edge of metacarpal 1. Okay, so this is how it's able to control your thumb. And that is it for the muscles of the upper appendage. Thank you.